Hi there, my name's Madeleine Gearside and I am a Policy Officer with Carers New South Wales. I'm really pleased to be presenting on diverse carer identities in health settings, and I'd just like to acknowledge Lisa and Lucas, my colleagues, for their contribution to this presentation. So I'd like to start by acknowledging the traditional custodians of the land from where I'm meeting on, but also the lands from where you're meeting on today. So for our North Sydney office, they are the Gorogal people of the Eora Nation. And I just want to pay my respects to elders past, present and emerging, and extend that respect to any Aboriginal person watching this recording. So I just wanted to start with our definition of carer, and we're referring to family and friend carers who provide support to somebody with disability, mental illness, drug or alcohol dependency, someone with a chronic condition or terminal illness, or someone who's aging or frail. So we're not referring to paid care workers or kinship or foster carers. We're referring just to family and friend carers. And Carers New South Wales is the peak non-government organisation for family and friend carers in the state. So you may or may not be aware that we have a New South Wales Carers Recognition Act and a Carers Charter, which recognises and increases awareness of the role and contribution of carers, both to our community and to the people that they care for. So the Act itself defines who a carer is, as I've just stated, establishes the Carers Charter and creates obligations for public sector agencies and also human service organisations. So the Carers Charter itself establishes 13 principles, and many of these principles particularly apply to diverse carers, including those who identify as LGBTQI+. So they include that carers should have the same rights, choices and opportunities as other Australians, that the relationship between the carer and the person they care for should be respected, and that the diverse needs of carers should be acknowledged and recognised in both policy, but also service delivery. And that includes taking into consideration the gender identity and sexual orientation of a person. So we know that family and friend carers in LGBTQI+ communities face particular challenges in their caring roles, and that's due to invisibility, discrimination and exclusion. So subsequently, these carers are more likely to be hidden carers, which means they're less likely to come forward to access support. Data from our 2020 National Carer Survey last year indicated that over 42% of LGBTQI+ carer respondents had a long-term illness or disability themselves, and over half reported high or very high levels of psychological distress. Nearly half felt that their caring role wasn't actually recognised by service providers, and a really large portion reported that they're not asked about their needs as a carer by either their GP or in hospital settings. So what we understand is that we have a Carers Recognition Act that stipulates that the diverse needs of carers should be recognised in policy and service delivery. But research is indicating that LGBTQI+ carers can actually experience barriers when accessing health services. And this is even despite the fact they experience poorer health and wellbeing outcomes. So Carers New South Wales LGBTQI+ Hidden Carer Project commenced last year in June with funding from the Department of Communities and Justice. And the project really sought to find ways to engage and support a greater number of sexuality and gender diverse carers. So we interviewed 13 SGD carers and spoke with 5 LGBTQI+ service providers between August and November of last year. The interviews were informal and very much guided by the participant, but generally covered topics including who the carer was caring for, their caring experience, what services they might have been accessing, and whether they'd experienced any barriers. Due to COVID, we weren't able to interview face-to-face, but interviews were conducted over Zoom or via phone, depending on what the participant preferred. And I think it's just important here to highlight or note the limitations of the study and just acknowledge that the stories we collected really only highlight some of the diversity that exists amongst these carers. We could only obviously take histories from carers who came forward and were willing to be interviewed. So these findings aren't generalisable. So the Hidden Carer Project really highlighted that the caring role for LGBTQI+ carers can be complicated by a lack of social and legal recognition of relationships and a family of choice. It can be complicated by isolation and fear of exposure or judgmental attitudes from either service providers or actual service users. And some of the other key findings included, in relation to relationships, that if an SGD carer wasn't out as such to their family or friends, they were expected to be more available to take on a caring role because they weren't living with a partner or a family of their own. When caring for parents or other biological family members, some carers had very complex feelings, and particularly where those care recipients might have been unsupportive of their identity. And some SGD carers were prepared to even become carers of biological family who'd been abusive about their identity in the past. SGD carers can avoid or delay accessing formal services, and they're taking on more than other carer cohorts as a result. So the access to and experience of formal services was very much influenced by the nature of the care relationship. So for example, if the care recipient was a partner, it was inevitable that the carer would need to be out to services, and this could be quite daunting. If the care recipient were heterosexual, the carer often found that actually their identity didn't factor into the caring relationship and they didn't have to be out in order to engage with services. Carers generally reported a lack of understanding from services, even when staff were trained and well informed. And some carers said that they were made to feel quite uncomfortable by other clients using that service. Even though there sometimes is a perceived sense of community in many SGD communities, many of the carers reported that this is actually an assumption and that there's a lack of support for LGBTQI+ carers specifically. So social isolation was a really key finding. In addition, carers reported that community and service assumptions around heteronormativity and homonormativity were quite common, particularly assumptions around couples and family structures, where some carers may have had poly families or been in different family structures. And many of the carers had questions about how they would be treated by services if their gender presentation is non-binary or otherwise diverse. And many carers felt worried and responsible for protecting the dignity of the person that they were caring for. So based on the conversation with carers about their lived experience, we've developed information sheets based on a range of topics, and these will be available on our website for download. As far as implications go, feedback from SGD carers indicated a really critical need for increased understanding of the carer role across all sectors, and that includes in health services. And that's even when that health service or service more generally is SGD specific. Investment in education about LGBTQI+ identities and experiences is really important for both community and for professionals. And this education would minimise the number of assumptions made about these carers, would likely promote inclusion and safety in service access, would ensure that health and other service professionals are aware of the complexity present in some of these caring relationships, particularly when there's been a history of abuse. And the education would increase the likelihood of SGD carers accessing services and, more importantly, accessing these services early. Continual quality improvement in services is integral to ensure that services both now and in the future are safe and inclusive for SGD carers, as well as the people that they are caring for. And we really hope that by sharing the stories of these carers, we can encourage other sexuality and gender diverse carers to come forward and to access the support they need to sustain them in their caring journey. So I left my references there at the end and our contact details should you wish to get in touch. Thanks so much for your time and take care.